PCOS Myths and Facts. Hello, this is Dr. Maha from Adela's Medical Videos and Podcast. I'm going to talk about PCOS, which is Polycystic Ovarian Syndrome. It's a condition of chronic anovulation. There is a wide spectrum of symptoms and severities a patient can experience. Patient usually comes complaining of either irregular periods or infertility. The main fact of PCOS is the anovulation that can lead to irregular periods and infertility. The first very common myth about PCOS is that every patient with PCOS is obese. Not true. A lot of women have normal body mass index, that is normal body weight. PCOS patients can't have babies. PCOS is one of the most common causes of infertility. The good news is that having PCOS doesn't mean you are sterile. Most women can conceive given right treatment, which is combination of medication and lifestyle adjustments. Another myth is that PCOS is rare, which is not true. It affects about 4 to 20% of women of reproductive age worldwide. Now, let me explain some facts about PCOS. The main issue with PCOS is the hormonal imbalance. The hormonal imbalance within the body of a woman with PCOS can lead to the anovulation and the irregular periods, the insulin resistance, and the increase in the androgen levels. Now, what happens is that irregular periods is due to the anovulation. And anovulation means no corpus luteum. No corpus luteum means no enough progesterone. There is unopposed estrogen, and the endometrium is chronically stimulated by estrogen without progesterone, leading to irregular periods and missed periods. On ultrasound, ovaries demonstrate the presence of multiple small peripheral cysts, which range between 20 to 200 follicles in each ovary. Stromal hyperplasia and thickened ovarian capsule all result in bilateral enlargement of the ovaries. That's why we call it polycystic ovaries, which again confirms the anovulation. Hirsutism, a condition seen in women that results in excessive growth of dark and coarse hair in a male-like pattern, that is face, chest, back, limbs, as well as acne, is due to increased in the androgen levels. As I said before, the disease is a spectrum of symptoms. The patient can also come suffering from mood swings, hair loss, back pain, headaches. The patient is suffering from the insulin resistance. Natural treatments for PCOS can improve many PCOS symptoms. For some, others may need the PCOS medication, combination birth control pills. Oral contraceptives containing estrogen plus progestin can help you manage the PCOS symptoms by normalizing your menstrual cycle. By reducing the levels of male hormones, oral contraceptive pills can help control the excessive hair and the acne too. If you are overweight, many of the symptoms will improve if you can lose just little. Dropping just 5 to 10% of your body weight can make your body more sensitive to insulin, reducing the insulin resistance behind the PCOS, lead to regular menstrual cycles, and could even help control the severe acne and the excess hair growth. Insulin sensitizing drugs, a particular medication called metformin, is usually prescribed. Another medication, pioglitazone, may also be suggested for women with PCOS. Fertility treatment. If the patient desires to get pregnant, ovulation induction can be achieved through clomiphene citrate clomid or human menopausal gonadotropin, HMG. If this doesn't work, some doctors suggest or recommend a surgical procedure called ovarian drilling. Lasers or a very thin heated needle are used to pierce several holes on the surface of your ovary, which improves the chances of successful ovulation. If these standard treatments don't work, some doctors can recommend the in vitro fertilization as a last option, removing or slowing the growth of excess hair. Shaving, bleaching, plucking, waxing, and applying over the counter hair removal creams are effective temporarily, but methods to get rid of unwanted excess hair. For more permanent results, you might try laser hair removal or electrolysis, but these are expensive, required repeated treatments, and not guaranteed to be successful. The prescription cream eflornithine HCl can slow the growth of new hair. Anti-androgen medication called spironolactone is used to slow the new hair growth. Another drug is cyprotrone acetate. Since many anti-androgens appear to cause birth defects, it is recommended to take birth control pills at the same time. It can take 6 months to see if the drugs are helpful in reducing the hair growth. Acne, birth control pills, anti-androgen drugs, and insulin sensitizing drugs, all mentioned before, can bring the severe acne of PCOS under control by reducing the high levels of male hormones that trigger the bad breakouts in PCOS. In addition, acne medications to unclog the pores, control skin bacteria, and soothe the inflammation. These may include retinoids, antibiotics, and products to help unclog the pores. Warn the patients taking retinoids that these medications can cause birth defects and cannot be used if you are already pregnant or are planning to become pregnant. Beware, the long-term effects of PCOS is that these women may be at higher risk for type 2 diabetes, high blood pressure, heart problems, and endometrial cancer. So maintaining a healthy lifestyle is all what you want to do. Thank you for watching. See you in another episode.